up and down with the emotional and physical stress that seeing the parents and the, it's just, we've got to do something about it. And we just ask for your yes vote to continue moving this forward.
Thank you so much for your. Is there anybody back here that would like, we don't want to, okay. Yep.
Thank you, Madam Chair. I'm Phil Jennery, and I represent the vape shops. We're monitoring the bill. Our concern that we have on this is the policy and tax in place. Just it is very hard for our stores to remain open with the federal law, with the PMTA laws that are currently on the books. There's only about a handful of products that can be sold, and just in the last year and a half, 2 years, the number of stores that we have that our members have that have closed is quite alarming. So not opposed to a tax or that, happy to have that conversation. But policies need to change so our stores can stay open. So if you do want to tax us, we have to be able to sell products to tax. And so I have some of that language that would help our stores stay open, while also helping law enforcement with cracking down on bad actors. So happy to have that conversation at this point.
Cindy Gangstead with the Denton Davis Brown Law Firm. We represent Philip Morris International, specifically to the tax framework portions of this bill. Philip Morris International shares the vision of a smoke-free future. We do not sell combustible cigarettes in the United States. So we appreciate the thoughtful process on taxation of harm reduction products. We want to emphasize that they do have a role in helping adult smokers switch lower alternative products. And we do encourage tax policy that reflects relative risk and does not discourage switching. So appreciate that was considered in crafting this bill. We would welcome a broader conversation on alternative products as well.
Tony Phillips with Reynolds American. I want to hit just a couple top line things that don't get mentioned at these meetings a lot. But if you look at the FDA's youth tobacco survey, overall nicotine usage, so that's anything by teens, is down 50%. So there is a success story there. I will also tell you the same behavioral health study that the University of Iowa research effort has been using and presented on here in the legislature shows that in Iowa, the smoking rate in Iowa from 2015 to 2024 dropped 24%. And they're on track to hit the single digits. And so people are switching. There is a public health success story here. But I wanted to touch on one of the questions that's come up on this bill previously is about the revenue it's going to generate. Based on our industry surveys and data, there were 17 million nicotine pouch cans sold in Iowa in 2025. There were 280 million milliliters of vape product sold in Iowa. And if you back those numbers out with the tax rate in this bill, that would generate the first year for 2025 would generate $14.8 million. Now they're growing categories, so those numbers will get larger now. But I know that was a question that has come up. I want to share that with you all.
17 million. We have to go vote. Yep. Oh, just hold 1 second. Pause. No, you're good. Tony, were you done? Okay, I just wanted to make sure. We didn't want to cut you off. All right. Go ahead.
Yep. Campbell, I represent the Iowa Behavioral Health Association and the Iowa Nurses Association. We're registered undecided because, of course, we are 100% support of pediatric cancer cancer research and funding going toward that. We do have concerns about the policy of the taxation. We don't feel that 5 cents is enough to change behavior, and that is their focus, is particularly changing behavior among younger users. I can't imagine that we're having vape shops closed because it seems like they're on every corner that you look at. We know that kids are getting them in schools. Teachers are confiscating vapes, they're confiscating the nicotine patches now. And we know that somehow it's getting into the youth use. And so that is the focus of nurses and the Behavioral Health Association, is preventing that addiction from ever happening. And so we know that young people are particularly price conscious. And we feel that if you truly want to prevent the use of these products, then we need to start and have a better taxation policy. So I know others are going to talk more in detail.
Do you want to announce it's time for us to vote again? Yeah, we got it.
Okay,
Okay.
so pause there.
Thank you.
You're next. Gina, is that our last bill?
That's
Is
it.
that our I
I think that's it.
Okay, that is our last bill, so my apologies. All right, I think we're ready to start back again. Go ahead.
Jackie Gale, I am with the American Cancer Society Cancer Action Network. There are 2 parts to this bill, so I kind of want to touch on that separately. It was unfortunate to see that a really good bill has been attached to a rather disappointing tax policy. So first, I want to touch on the appropriation. We are extremely thankful for prioritizing investment in pediatric cancer research. Because Canada will support this funding. We do urge you to support the House bill, which is a standalone appropriation. That is HF 2758. That would not be attached to this particular funding mechanism. But in order, here talking about the tax today, we are opposed to the tax in this bill. This bill taxes vapor products and nicotine pouches at 5 cents per container or per milliliter. This is a negligible amount compared to the recommendations put forth by the public health community. As Amy mentioned, research shows that in order to change behavior, the tax needs to be substantial enough to impact price. 5 cents on these products is just not going to have that impact that you're hoping for. In addition, we know that taxing these products by the wholesale cost is the easiest and most effective way to collect this tax. That's what we already have in place in Iowa. And then second, I want to touch that this tax will do nothing to reduce our cancer rate. So 2 weeks ago, the Senate Aging Tax Committee heard from the University of Iowa Public Health and Iowa Cancer Registry on the key drivers of cancer studies. While there's still a lot unknown about cancer rates in Iowa, we know for a fact that Iowa has a higher incidence of lung cancer and mortality in the U.S. and with our Midwest neighbors. We are falling behind with our tobacco policies, and we do have a solution to reduce our lung cancer rates and to prevent youth initiation, but this bill unfortunately does neither. We have been working with Representative Barker on a comprehensive tax bill that would include a tobacco tax increase by $1.15 per fat box cigarettes, and then would add e-cigarettes and nicotine pouches at a 50% wholesale, which is to other tobacco products in the state. And we highly recommend moving that bill forward instead of the bill that you have today to show that I was very budget at the rate. And then we urge you to prioritize cancer research funding with a comprehensive tobacco tax bill if that's the way you'd like to go. And then in putting that all together, it would address cancer rates and then prevent you from starting products altogether. Thank you.
Thank you. We're gonna go right behind you, because I know you're good. Is there anybody that joined over here that needs to speak? Okay. Yep. All right, now go ahead. Yes.
Sharing our last year with the campaign for tobacco free kids for registered posts to the bill for the tobacco tax
sufficient. So like Jackie just pointed out, we don't like this bill to say it's not comprehensive, meaning it's not exclusive, cigarette tax. And B, what is in there is just far too low. But I wanted to touch on just a few technical concerns specifically around definitions that are in the bill. So when it comes to the nicotine analog definition, we have some concerns that this may be prone to federal preemption and litigation because it's appearing to potentially regulate a product standard, which is expressly preempted by the Tobacco Control Act. So the language is problematic because it seems to reference the infrastructure and analog and the pharmacological effect on the system or the mind. So some concerns there. Additionally, with the actual tax on the alternative nicotine products, as you know, for pouches, it's proposing a 5 cent per container tax and up to 20 units. But what it's missing is the definition for container or unit. And that we see as highly problematic, potentially able to be manipulated by manufacturers and industry. And likewise, it would probably require the state to do a bit more in-depth inspection and to do.
Excuse me.
With regards to the vapor tax, it's 5 cents per milliliter. And there's some conflicting description of how we're defining the liquid in this space. So in one section, it cites 5 cents per milliliter of nicotine in the solution. Not quite sure how you want to measure that. That could be very difficult. But then there's also another section where it talks about the volume, the net volume of the solution. So those two things are conflicting. Not quite sure which part of the solution we are taxing. Again, this just leaves room, I think, for over-reliance on manufacturers to be telling you what is in their product rather than the state having a clear understanding of what's in the product, what they're taxing. This is why, again, we recommend that wholesale cost price. It's just cleaner rather than getting into the nitty-gritty and potentially opening yourself up to some manipulation.
Thank you.
Hello, Senators Teresa Harms. I'm here on behalf of Cafe Iowa, registered opposed to legislation. And instead ask you to pursue a more consistent, fiscally responsible approach to nicotine and tobacco taxation next session. At the appropriations subcommittee, we learned that this nickel tax would generate about 15 to 18 million, confirmed by my colleague today. We're not sure how you get that number because Iowa doesn't have access to that. There is a lack of data. The vapor products and nicotine pouches are not distributed in the same way that traditional tobacco products have been in the past. Thus, it's difficult to track the sales of these products. Most of these come in, or most of the sales are tracked right now through retail sales, and those sources only collect data from traditional stores like convenience stores and gas stations. But these products, as you've heard, are also sold in vape shops and online, and then they can also be directly sourced from manufacturers rather than going through a wholesaler. So it's very unclear about the actual number of products that are being sold in our state. In addition, there isn't good data on prices of these products, especially since the category is so diverse and includes not only the disposables, but also separate cartridges, bottles, and e-liquids and devices and parts. So sometimes you put out cartridges, sometimes it is the whole product, that sort of thing. What we do know right now is that about 10 to 15% of the adult population in Iowa are using these products. So if we break down the numbers, that's about 360,000 Iowans. If this revenue were to be realized, then each one of these individual 360,000 Iowans who are legally allowed to purchase these products would need to purchase 16 tins or pouches for this to be realized, or they would need to do like or 16 vapor products a week. So on average, that's more than 2 of these a day, right? Or 2 of these a week, I'm sorry, 2 of these a week. And these contain the same amount of nicotine as anywhere from 3 to 22 packs of cigarettes. So thinking about the amount of nicotine in these products alone, this isn't realistic, or nor should it be encouraged. So what we know is that in this tin of pouches that are going to be packed at 5 cents, it would be less than 1 penny pouch. There's 18 I think there's 18 in this product here, 18 pouches, we tacked it at 5 cents. Okay, a can can sometimes have the same nicotine equivalent to a pack of cigarettes, which is taxed at $1.36. This one in and of itself has 18 milligrams per pouch, okay? So this geek cart, which retails for $20, right now, is would be taxed at about 80 cents based on the 5 cents that in the definition, that we're taking it, that's outlined in the bill. So this would be 80 cents, tax. It's equivalent to 22 packs of cigarettes. So if we back that out to the 22 packs of cigarettes at $1.36, that would be $30 for taxing on the same amount of cigarettes that you're getting in this heat bar. All right. So it's very affordable, right? So this bill encourages and incentivizes more products to be purchased to increase revenue. And I would actually ask, what's the intent of the bill? Is it to address the tax and kick this issue down the road for another 20 years, because that's how long it's been since we've addressed tobacco tax? Is it to raise a little bit of revenue so that we can then addict the next generation of youth to use these products? And so I would tell you that the goal of the tobacco control community is to reduce the death and disease caused by these products while curbing youth initiation. This bill doesn't get it done. It's not going to do anything. It's gonna help these products be available to our youth, and unfortunately addict and create more cancer crisis in our state. Thank you.
Good afternoon, Brad, on behalf of the Iowa Grocery Industry Association. My comments are limited strictly to the tax portion of the bill. We have registered undecided, full disclosure, to soon not have any tax added. The impact, I think the most significant impact to our members, which are both grocery stores and convenience stores, are forward. And these things add up to decisions that consumers make. In our border communities, if it's cheaper somewhere else, they can just go across to purchase their product there. The problem is they don't just purchase the nicotine product there, they purchase their groceries, purchase their gas, etc. So these things do have an impact. They accumulate over time and drop the business regard to our independents, which struggle to compete in the first place with large members. So just ask you for careful consideration. Thanks.
Thank you. We're gonna come back over here because we had some people add from behind. So go ahead.
Thank you, Senator. Jay
Yep.
Highfield with Reynolds America. We're registered undecided on the bill. I want to give you a little, we touched 6 states in Iowa, looking at our states in our region. Most have no tax or 5 cents per milliliter tax on vape products. A milliliter approach ensures the states do not provide tax advantage to illicit Chinese products that come with things like what colleague Ms. Harms brought over here. No tax on vapes, South Dakota, North Dakota, Missouri, 5 cents a milliliter in Nebraska, Kansas, and Wisconsin. Similarly, regions with no stakes in nicotine pouches, I believe, are South Dakota, North Dakota, Missouri, Kansas, and Wisconsin. Tax pouches based on price, Minnesota, Illinois, Nebraska. I also made a couple comments, as you guys remember, talked about youth vaping. Did pass the 221 2017 state level. They passed it a couple of years later at the federal level. So the tobacco age is 21 and has been for a while now. The list of vape we talked about with the vape registration, 30 years ago, we passed a registration for smokeless tobacco and cigarettes, and that's been in place for 30 years. 2 years ago, everybody here voted for the vape registration. It's been in courts in 2 years. It's not once been enforced, so it's been in courts. That's been effective in the summer, but we do support that as well. Thank you very much. I appreciate your time.
Good afternoon, David Peck on behalf of Fuel Iowa. So fuel retailers, convenience stores, gas stations, we have our members that are similar to Mr. Epperly's members at the Grocers Association. We're interested, undecided on this. I'll just, echo some of the things that Mr. Epperly made. I'd comment that we worked with Mr. Highfield and some of the other folks in this room 2 years ago on the vape registry bill. It's currently tied up in litigation, so we'll see where that goes. But I did just want to make one comment about the per milliliter taxation versus wholesale taxation. I think if there were to be a wholesale taxation, there might be some unintended consequences. And the reason that I say that is typically a lot of the counterfeit products that are produced overseas, sold here illegally, they're already at a lower rate. And so if you're going to tax that at a wholesale rate, those prices are really not going to raise much at all, right? The ones here that are FDA approved, right, that have gone through the process, that are sold legally in our stores, if those are taxed at a wholesale rate, those prices go even higher, right? But those have at least gone through the FDA process. So there's a concern there, looking at it milliliter versus wholesale. Thank you.
Thank you so much.
If you don't mind, may I?
Okay,
Sorry, just because products that contained our name was utilized as a demonstrative here in the subcommittee, so I would just like to speak to that briefly. Our colleague Teresa Farms held up a product that has the label thin on it that states that it's an 18 milligram can. That is an illegal product that is not sold by Thin, and I would just like to clarify that because there are media here and that did have a picture of the label Thin on it. That is not legally sold by Thin. Also, as stated, our products must be purchased through retailers and cannot be directly bought through the manufacturer. So I think that is fair to state on the record.
okay. Thank you so much. Let's go online. Paige, how many people do we have?
16.
Have their hand up?
Oh, no.
Oh, Jennifer. Jennifer, if you could unmute, go ahead.
Hi, everyone. This is Jen Harbison. I'm with the Iowa Board of Regents and University of Iowa Healthcare. I'm just going to speak on Section 3, B1 and 2, which is the directive to provide $3 million to the Board of Regents for purposes of research, therapies, and physician scientist support at University of Iowa Healthcare, said Family Children's Hospital. We would be able to carry out those duties and have been, supportive but not registered on the bill. We're just monitoring, but as was noticed in the House, there has also been talk about providing funding to University of Iowa Healthcare for pediatric cancer research. And I'm just here to answer any questions if there might be any related to that.
Thank you so much. I am seeing none. Christy, go ahead.
My name is Christy Polonsky, and I lost my son, Jack, in July of 2025. He had a 3.5 year battle with T-cell lymphoma. One of his wishes when he knew he would not make it was to be his voice. I understand through listening through all these comments, this is not the perfect bill, but it is a bill that would do good. We can always make bills better. We know we increase taxes all the time. With this would start funding pediatric cancer research in July of 27. It would allow these researchers to get started on better treatments for children. We know that every year that we wait, those treatments are not helping our generation, next generation of kids. These treatments that kids receive are basically dosed down from the adults. There have been 3 drugs since 1990 that have passed specifically for pediatric cancer. 4 more drugs have passed the FDA approval for adult and children at the same time. Since 2010, 45 new treatments have been available for lung cancer. We aren't doing enough for our children. And I just ask that you pass this and start funding pediatric cancer research in the state of Iowa. Thank you.
Thank you, Christy. Marty, you're next.
So my name is Marty Post, and my son Charlie was diagnosed with acute lymphoblastic leukemia at 4 years old. His treatment lasted over 2 years, and even now we have regular visits to the University of Iowa Children's Hospital for monitoring. A diagnosis like Charlie's brings immediate fear and uncertainty, as well as a deep reliance on access to specialized care and research. That's why this bill matters so much. It creates a sustainable way to invest in pediatric cancer research by directing revenue from alternative nicotine and vapor products into the Healthcare Trust Fund, up to $3 million annually that can support research, clinical trials, and physician scientist leadership at the University of Iowa Children's Hospital. Children facing cancer, they don't have a voice in legislative decisions like this. They rely on adults. They rely on leaders like you to advocate on their behalf. And so as you consider this bill, I ask you to think about what it means to represent Iowa's youngest and most vulnerable patients. They deserve every opportunity not only to survive, but to grow, thrive, and live full and healthy lives. So with the limited time that's remaining in the legislative session, your support is critical to ensure that this bill continues forward. Thank you for your consideration.
Thank you so much. Is there anyone else online? I don't see anyone else. Senator Peterson, do you have any closing remarks?
I have some questions. First off, thank you to all the parents who've come and shared your story. And I think it's very important for the state to be investing more money in cancer research for all Iowans. And clearly, this is the issue that people really want the legislature to be tackling this year. I do have some concerns the way the bill is written. First off, it says up to, or excuse me, not to exceed $3 million from the amount of tax collected. That means it could be $1. And so this is not a guaranteed $3 million. Secondly, the person that would be making the decision, if I'm reading the bill accurately, the legislature, once the bill leaves our hands, if this becomes law, it would be up to whoever is in charge of that fund to determine what amount would be going to pediatric cancer, anywhere from $1, no more than 3 million. And if you look at the current Medicaid situation and the amount of shortfall we're going to see in the upcoming years, they could completely scoop that money from pediatric cancer to try and just fill the hole. We know we're facing back-to-back billion-dollar plus budget deficits. And so this does not guarantee an ongoing funding stream for pediatric cancer. Secondly, I have concerns that this is an industry bill. This taxation method benefits the industry more than it benefits Iowa's revenues. I would like to see something more similar to what is being proposed in the House that goes after wholesale. The first time I saw Branstad increase the tobacco tax on cigarettes, I was 19, and it got raised to 36 cents. The second time I saw tobacco tax raised was in 2007, and we haven't raised tobacco taxes since. We need a comprehensive package that our health community supports. We need more guarantees for families who would like pediatric research. This bill is not there. And I believe we can get there. Not a single budget has been passed through both chambers yet. So you get it in the standings bill, something where you don't have to fight for it year after year, or have some unelected department head say, we're going to give you $1 this year. So this still has a lot of work. And again, the way it's written, it is not a guarantee for pediatric cancer research.
Thank you. Senator Cowker.
Yeah, thank you, Senator Driscoll. I have a question for Jennifer from the University of Iowa, and I don't know if you can answer it now or not, but what do we currently is invested, not state dollars, but just dollars invested in pediatric cancer that you're currently housing under at the University of Iowa? Do we know that answer?
So right now, specific for pediatric research only and for pediatric trials, there would be less than $1 million. I think it's maybe around $300,000. All of our research funding, with exception of some money that the legislature dedicates for melanoma funding, is all federally awarded or through other national entities that we apply and seek funding to. And a lot of it's driven by who is on our faculty and staff and what their area of expertise is. So it can vary. And we have had previously, I think one of the researchers had a $3 million grant over a period of years. We do have a significant amount of money in cancer research that can be utilized to support pediatric areas of research. But I think the advocates would point out that, adult research and adult treatments are different or should be different than what is available for pediatrics. But we certainly do a lot of pediatric cancer research, cancer research, and we do a lot of pediatric cancer treatment, healthcare treatment. Does that answer your question?
Sure. Thank you very much, Jennifer, for those details on the spot. Obviously, money, we can't buy health, right? We all know that. I wish if it could, we'd all be in just a totally different world. But I've been part of the unfortunate journey with my family, and so it's a passionate spot of mine. And at that time, money can't buy health, but you pray that you can get that. But so I've seen the inside and outside walls, tragic and blessed walls, for 7.5 months of STED. And so, it all starts with a conversation. And I think that we've seen the cancer research, and I think we can't point to one finger or another. But I like how we're carving out pediatric cancer versus just cancer research in general. I mean, we all attend and donate to the dance marathons and things like that. So I think it all starts with a conversation. I'm happy to sign it out today to continue that conversation. Obviously, we need to come upon this. I don't know if this bill's in its final and perfect form. I would agree it's probably not, but I think that it starts with a conversation and we can adapt it and adjust or grow it. I appreciate Senator Peterson's comments in regards to we don't need it to be $1. We don't need to go to all this effort and say it's for $1 of research. So we probably need to fine tune that up as well. But happy to sign it out today. Thank you, Senator Driscoll. Thanks to all of you for attending on both fronts on this today. I appreciate it. And moving on, back to you.
Yes, I'm going to be signing it out today as well. And I do want to take the time to absolutely thank every single person who came in to advocate for this. I know it's not easy. And just like it was said, we are the voices. And I think as far as the appropriations, it states in there, the purpose of conducting pediatric cancer research, clinical therapy access for providing the physician scientist leadership at the U of I Stead Family Children's Hospital beginning in FY28. So if we need to, make sure that is any more clear, I would be happy to, continue to work on that. But we happy to sign this out and keep this conversation going, because I think that what we're faced with this bill is a good start. So thank you so much.
So basically, you're saying you're open to an amendment to clarify that they can't.
Well, I mean,
under
if
the